Make sure it was crashed there. Good afternoon, ladies and gentlemen. Welcome to the regular Board of Commissioners meeting of the North Broward Hospital District. Today is September 25, 2017. Pam, would you please call the roll?
Commissioner Rodriguez?
Here.
Commissioner Murray?
Here.
Commissioner Robinson? Here. Commissioner Wellen?
Here.
And Commissioner Clement.
Here.
Okay. Do we have any comments from the audience?
Mr. Chairman, I have some
Okay. Is anybody? No public comment? Okay.
Chairman, if I may,
Yes.
given the controversy this weekend, I think it's important that we recognize the flag and pledge allegiance before we move on.
Oh.
I think that's
I apologize.
one of the most important things this country should
Yes, you're right. I
respect.
apologize. Commissioner Klein, would you please lead us in the pledge?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. All right, I got two items here, but what I'd rather do is, I want to get done with the minutes, so let me, and then I'll go right back onto the agenda. Request for approval of the minutes, regular meeting of the Board of Commissioners held October 15, 2017. Is there a motion to approve?
So moved.
Moved by Commissioner Wellens. Do I have a second?
Second.
Second by Commissioner Yuri. Any discussion? All in favor?
Aye.
Aye. Aye, motion carries. And then request for approval of the minutes, regular meeting of the Board of Commissioners held on August 15, 2017. Is there a motion?
So moved.
Moved by Commissioner Yuri.
Second.
Second by Commissioner Wellens. All in favor?
Aye.
Okay. All right. I have been trying to catch up on some of these things that, you know, through the summer we had, you know, people on vacation and really short-handed here, and I've been, one of the things that I've been trying to follow up on all the stuff that we have in mind to do, or some stuff that got frozen in time, and I'm trying to get a lot of this stuff done. And one of the things is the Chief Internal Auditor process and protocols. And here's what I'd like to recommend to the board. We do need to have a Chief Internal Auditor in place in order to do our meetings and be able to fulfill all our responsibility, especially with working with the auditors and the monitors and compliance and everything else. During a couple of months ago, we, Commissioner Yuri, and by the way, I want you to know that I just brought this on the agenda. I wasn't trying to, you know, get involved in your suit, but rather than just bring out some of these things that we all forget, the thing is that in order for us to continue, we gotta have somebody at the helm. Now, one thing that I reviewed recently was the fact that, if you recall, we had an HR committee meeting back in May, and where you, I think we all made the recommendations. There were 4 people that we had listed to interview, and that's kind of frozen in time. In the meantime, we need to have someone at the helm because audit it's a very important, critical part of what we do. So my thinking is, if you folks have any suggestions of anyone in that department that we could assign as an intern in order to get the job done that we need to do right away, provided that we also later on, since this was an open process and it was closed, to give the opportunities to all these, before the final decision to the permanent replacement, that these 4 people get the opportunity to be heard and have our HR person, perhaps, Peter, if you would call these folks and make sure that they would still be interested on the job, and in the meantime, I believe that it's incumbent upon us to perhaps pull one of our employees who are actively doing this kind of work, someone that is knowledgeable about the auditing department, someone that is capable. So I'm leaving it up to you folks to, and I'm like to hear some reference or what have you. So.
Well, if you're looking at me, ultimately I agree. I mean, unfortunately, with the leadership changes that we've experienced over the last many months, there's a few things that have fallen through the cracks. This would be one of them, and to your point, at least naming somebody, I would presume from within as an interim person. I think it's certainly something we need to do. It is my understanding that the person's name escapes me right now because I had some conversations with the auditing firm, but there is a person in the department that, from what I understand, has, I guess, taken it upon themselves to step up to the plate and, for all intents and purposes, function in this role. And I apologize, but I don't remember her person's name.
Here's
But
a list of all the people that had applied.
yeah, I think it was Nigel. Anyway, again, having somebody in an interim role is I think something this board needs to do, especially as we should have audited financials here very soon. So there's a lot of other things that are going to be ultimately going on. So.
Okay, Peter, congratulations. Welcome to the Calderas box. You're in the hot seat. So I wish you luck on your new job. Would you have any recommendations that perhaps this board, knowing that you've been with a few days on the job or what have you, but I know that you've been out around and checking things out, so.
Absolutely, Commissioner. Thank you, Board. I'm just really excited to be a part of this team. Thank you, Bev, for the opportunity. Nigel Crooks is the individual that has been really a standing leader in this department since October of 2016. And by all indications and from my experience, I've seen only good work coming from him to this stage. So I think if it's just a matter of coming up with an interim selection, I think it's my recommendation that the board just appoint him as the interim as we go through the process, and I'll contact the 4 individuals that you mentioned, Commissioner, and we'll go from there.
We just want to make sure that since they had an interest on it, they'd be afforded the opportunity to present their case before we finally make a final permanent position. So,
Absolutely.
all right. Thank you very much. I really appreciate it.
Absolutely.
Commissioner.
Thank you, Commissioner.
Would, in this process that I guess you guys have set before, Would our interim also be eligible for consideration for the permanent internal auditor?
I can respond. The position is actually open for application, so in that, as a result of the position still being in the recruitment process, he can apply for it and would be considered the same as the rest of the individuals.
Right. I just want to make sure, because if there's someone inside that has stepped up to the plate, doesn't assure that person of the job, but I want to make sure that any individual who's can apply if they're already here and will be given the same consideration as far as qualifications, et cetera, as anyone who applies from the outside.
That is absolutely correct. The only thing that I would add to that is that there may have been also additional people that have applied to this point since the 4 individuals were selected. So in my review process, I'll review all of those and hopefully present that to the commission as well.
Can
Right.
I ask a question? Am I mistaken that Nigel had applied when the application process was
Yes,
open?
yes.
He was one of the candidates that had applied for the position.
Right, that is
So
correct.
he still could remain if he chooses to stay and apply for it, he still would be in there because he was already.
He's already applied. Yeah,
Correct.
That's correct.
Right, I just want to make sure that someone
Not
filling
precluded.
an interim position
Could still.
does not lose their right to continue to be
Right.
a permanent
Yeah.
applicant. And many times we've made the distinction between interim is just serving until we find the
Right.
permanent. But I also feel like it's very important for the organization, for someone who's here, to also feel like they're on equal footing.
Yeah, absolutely, and you're right, and we thank you for that. That's the point well taken. Well, thank you very much. So
Thank you, Commissioner.
you're welcome.
Well, I would certainly move that we go through the formality of naming Nigel Crooks as the interim chief internal auditor. I too have heard great things, both inside and outside the organization. So from an interim standpoint, I think that would be wise of this board. So.
All right, so do we have a motion from Commissioner Uri?
Second.
Second, Commissioner Robinson. All in favor?
Aye.
Okay, motion carries. Nigel here?
Yes.
Where are you? Oh, hi, you want to come over and say hello? I want these people to know who the money man is.
Thank you very much, Commissioners and Senior Management. Thank you. I'm Nigel Brooks, and I've been running the Internal Audit Department since October of this year. And so, last year. And so I've been doing all that I can to ensure that the board objectives and management objectives is reached. It's fair shade, and I'll continue to do so. But I appreciate it very much, and thank you.
You're welcome. Thank you very
Thank
much.
you for stepping up.
Nigel, as many people said to me, congratulations, I think, when I took this role. So I think you'll do a great job, and I know you've been doing a great job since October. So we look forward to you continue working with us and keep up the good work. Thank you.
Thanks.
General Counsel, you got some news for us?
Yes, we have some good news. We would like to request that the board approve a settlement that would resolve a monetary demand from the Florida Attorney General's office that came in last year. This is a monetary demand that is not new, but was related to the Riley case, which is the case that was settled with the United States government in August of 2015. So when that case was settled, it resolved the federal portion, and several months thereafter, we got a letter from the Attorney General requesting the state share. And while we didn't always agree on everything, we had a very productive and cordial set of negotiations. And if the board agrees, we would like to settle the matter on the state side for $1.5 million, which is quite a bit less than what was the original demand. But we've worked very cooperatively, as we have worked with all of our regulatory agencies, and we think this is a very, very good thing also to put the past behind us. It relates to the limited set of physician contracts that were in the Riley case, And we'd like to recommend that you approve the interim chief executive officer to sign the settlement agreement after general counsel has reviewed. It's a standard state settlement agreement.
I may add to the fact that I was one of the, probably designated survivor when we signed that agreement with the federal government, and I was very clear that there would be some residuals owed to the state of Florida. And at that time, it was kind of concerning, but I don't know if that was a service fee or a tax fee or give me some money, but
Medicaid portion.
But it's a good job that I concur with that amount. 1.5 is a drop in the bucket compared to what we saw back then. That possibility. So
You are the only participant in the conference. Please press any key on your keypad to remain in conference.
the machine talking to me.
Mr. Chair.
Yeah, go ahead.
Just for the record, since this has been around a while and we've got new members, and actually I wasn't even here when the original claim was made, could you, I know it's the Medicare portion where the states definitely want to get their share. Could you sort of just for the record explain how much they asked for? And I guess my major concern with our CIA, we have a lot of continuing obligations that cost the institution a lot of money. Just to report and continue to report. In the settlement agreement that you've been working on, could you sort of explain to us whether or not this is it, final with the state on that particular allegation, and so we really know what we're settling once and for all?
Sure. This would be it. There are no continuing obligations as in the CIA with 5 years of reporting and IRO. It was a monetary demand for repayment of the Medicaid portion. So there are releases, and there are things as normal. They wouldn't release criminal activity, things like that. But it is a relatively brief document, as I understand it. Several pages.
But they originally claimed we needed to write them a check for what amount?
A little over 5.3 million.
I think it's important because in any settlement, you start with a number, it's their dream. Obviously, we would like a zero. But then to come to this amount, to get it over, behind us, and completely done, is, I think, important for the record. And I'm supportive as well.
I also think it sounds like the parties were both served. Move on. I think it's a reasonable amount of money. I think it's the only dispute was how much, and I think we should move on and close that chapter and get back to what the focus of this organization is. And I commend you for getting this done.
Can I just ask, the parameters of the settlement are the same parameters of the settlement with the federal government in terms of either time or specific issues, or this is from this point in time back?
From this point, so again, it's
General,
nothing new.
total.
It's the same physician contracts that were the subject of, with the same physicians that were the subject of the federal case. So it is, once you sign and Mr. Goldsmith releases the money, which I think he'll do, then we're done.
If he's authorized.
If he's authorized. Then it would be, there are no continuing
No, what I
reporting
mean
or other
is
obligations.
What I mean, I don't mean that. What I mean is just like with the federal government, the settlement was confined to
Yes.
specific
Correct.
issues. So this settlement, I assume, models those specific boundaries from, in other words,
The
we
same
could, God
physicians.
forbid, we could still have another federal issue from 2014 or another Medicaid issue with the state of Florida from 2014. It has nothing to do with the fact that we're settling here. It's not a universal
No.
blanket settlement from this date prior.
No.
It is confined to those things,
To
correct?
those physician arrangements that were the subject of the federal, there were 9
Okay,
physicians.
that's what I want to understand.
Yes.
So do I hear a motion to approve?
I would move that we approve and swiftly move to reach
To write the
settlement.
check?
Yes.
No second.
Move and second, any discussion on the motion? Okay, all in favor?
Aye.
Aye.
Okay, motion carried.
Good job.
Thank you. Alan, we gotta write another check, huh? All right, Dr. Westfall, how are you, sir?
Very good.
Fine, thank you. Medical staff update.
Yes. Commissioners, welcome, Mr. Klein. It's good to have you. Yep. We're going to start with Broward Health North, and I'll ask for a motion on each of these presentations. They're a little bit lengthier, I think, than what you're used to, but I'm going to go ahead and go through these. Due to Hurricane Irma and the need to reschedule C&Q and the MEC meetings, there were no initial appointments for the month of September for Broward Health North. 8 positions were reviewed for reappointment without change in status, and all were recommended as submitted, including requests for clinical privileges. 5 positions were reviewed for reappointment with category changes to reflect their current case volume as per the medical staff bylaws. 3 positions were moved from active to courtesy. 1 position was elevated from provisional 1 to active, and 1 position was moved from courtesy to affiliate due to change in practice patterns. All were recommended as submitted, including clinical privileges as requested. 1 position was recommended for reappointment to provisional 2 due to a patient encounter requirement not being met. As per the medical staff bylaws, these applicants may be reappointed to provisional 2. Recommend reappointment to provisional 2 with clinical privileges as requested. 8 allied health professionals were recommended for reappointment to the allied health staff with clinical privileges as requested. 2 positions requested a change in primary facility. 1 position's new primary facility will be Imperial Point, and 1 will be Coral Springs. These positions will maintain medical staff membership and clinical privileges at Broward Health North, which will now be listed as a secondary facility. 2 allied health professionals requested to add sponsors. Request was recommended for approval as submitted. 2 positions were processed as voluntary resignations due to 0 activity in the past 24 months. All were recommended for approval as submitted. No quality, peer review, and/or HIM issues were identified or reported by the medical staff office for any position allied health professional covered in this report. No additional and/or other miscellaneous requests were reported. So, do you want to do you have a motion to approve that, or would you like to approve them in mass?
No, well, that's, we can do it in mass.
Okay. Next is Imperial.
We better one, for the record.
Yeah, I thought that.
Just one.
Yeah.
Yeah, each hospital.
That's what I thought.
All right, so is there a motion to approve recommendation from Dr. Westfall on the Broward Health North?
So moved.
Moved by Commissioner Robinson, second by Commissioner Wellen, all in favor?
Aye.
Okay, is there, motion carries. Is there a motion to approve Dr. Westfall's recommendation on Imperial Point?
Let me present that if I may, Commissioner. That was just for Broward Health North.
Oh,
Due to Hurricane Irma and the need to reschedule C&Q and MEC meetings, there were no initial appointments presented for the month of September. 14 positions were reviewed for reappointment without change in status, and all were recommended as submitted, including clinical privileges as requested. 2 positions were reviewed for reappointment with category changes to reflect their current case volume as per medical staff bylaws. 1 provisional 2 member was elevated to courtesy, and 1 courtesy was moved to consulting due to a decrease in activity over the past 24 months. All were recommended for approval as submitted, including clinical privileges as requested. 2 positions were recommended for reappointment to provisional 2 due to patient encounter requirement not being met. As per the medical staff bylaws, these applicants may be reappointed to provisional 2. Recommend reappointment to provisionals 2 with clinical privileges as requested. 8 allied health professionals were recommended for reappointment to the allied health staff with clinical privileges as requested. 1 allied health professional requested to add a sponsor. Request was recommended for approval as submitted. 11 physicians and 2 allied health professionals requested voluntary resignations and were recommended for approval as submitted. Again, no quality, peer review, and/or HIM issues were identified or reported by the medical staff office for any physician or allied health professional covered in this report. No additional and/or other miscellaneous requests were reported.
thank you. Is there a motion to approve the recommendation of Dr. Westfall on the Beacon?
So moved.
Move and second, anybody second it?
Second.
Second by Commissioner Robinson, moved by Commissioner Wellen, all in favor?
Aye.
Motion carried.
Next is Broward Health Coral Springs. During the month of September, Broward Health Coral Springs appointed 3 new medical staff members and 2 allied health professionals. All files were reviewed and found to be appropriate with no outliers, deficiencies, or red flags. CNQ and MAC recommended appointment to the provisional 1 staff with privileges as requested. 14 positions were reviewed for reappointment without change in status, and all were recommended as submitted, including clinical privileges as requested. 3 positions were reviewed for reappointment with category changes to reflect our current patient encounter volume as per the medical staff bylaws. 1 provisional member was elevated to active, 1 provisional member was recommended for elevation to consulting, and 1 active position was moved to courtesy due to a decrease in activity over the past 24 months. All were recommended for approval as submitted, including requests for clinical privileges as requested. 1 position was recommended for reappointment to provisional 2 due to patient encounter requirements not being met as outlined in the medical staff bylaws. Recommended reappointment to provisional 2 with clinical privileges as requested. 6 allied health professionals were recommended for reappointment to the allied health staff with clinical privileges as requested. 1 physician surgeon requested to delete 6 privileges due to a change in practice patterns, and 1 physician and interventional radiologist requested to add 1 privilege in which all required documentation was reviewed and approved as provided. Both requests were reviewed and recommended for approval as submitted. 2 allied health professionals requested to add a sponsor. Request was recommended for approval as submitted. 12 physicians and 6 allied health professionals requested voluntary resignations and were recommended for approval as submitted. Again, no quality, peer review, and/or HIM issues were identified or reported by the medical staff office for any physician, allied health professional covered in this report. No additional or other miscellaneous requests were reported.
Thank you. Is there a motion to approve the recommendations by Dr. Westfall on Coral Springs?
So moved.
Move and second.
Second.
Second by Commissioner Klein. Moved by Commissioner Weller. All in favor?
Aye.
Okay.
Last is Broward Health Medical Center. During the month of September, Broward Health Medical Center recommended for appointment, 2 new medical staff members and 5 allied health professionals. All files were reviewed and found to be appropriate with no outliers, deficiencies, or red flags. CNQ and MEC recommended appointment to the provisional 1 staff with privileges as requested. Appointment to CHS, UCC, and Weston. 1 allied health professional was recommended for appointment to work at the urgent care centers. The file was reviewed and found to be appropriate with no outliers, deficiencies, or red flags. CNQ and MEC recommended appointment to the provisional 1 staff with privileges as requested. Moving on to Medical Center, 1 allied health professional requested to add a sponsor. Request was recommended for approval as submitted. 1 physician requested a change in status. Request to elevate from active to senior active. Physician fulfills all requirements as outlined in the medical staff bylaws. Recommended approval of request is submitted. 1 physician requested a leave of absence 1 year. Committee recommends approval as requested. 8 physicians and 2 allied health professionals requested voluntary resignations and were recommended for approval as submitted. 21 physicians were reviewed for reappointment without change in status, and all were recommended for approval as submitted, including clinical privileges as requested. 5 physicians were reviewed for reappointment with category changes to reflect their current case volume as per the medical staff bylaws. 2 provisional members were elevated to active. 1 provisional 2 member was recommended for elevation to courtesy, and 1 provisional 2 physician was elevated to courtesy. All were recommended for approval as submitted, including clinical privileges as requested. 6 positions were recommended for reappointment to provisional 2 staff due to patient encounter requirements not being met. As per the medical staff bylaws, these applicants may be reappointed to provisional 2 with clinical privileges as requested. 12 allied health professionals were recommended for reappointment to the allied health staff with clinical privileges as requested. Community health services and urgent care centers did not have any reappointments or requests for the month of September. Again, no quality, peer review, and/or HIM issues were identified or reported by the medical staff office for any physician or allied health professional covered in this report. No additional and/or other miscellaneous requests were reported.
Thank you, Doctor. Is there a motion to approve recommendations from Dr. Westfall on Broward Health Medical Center?
So
Moved by Commissioner Yuri, second by Commissioner Robinson. All in favor?
Aye.
Okay, motion carries.
Thank you.
Thank
Thank
you. Good report.
Mr. Chairman, can I approach the podium?
Yeah, go ahead.
Thank you, Chairman Rodriguez. I'm a little concerned that as the Chief of Staff, we've seem to be eliminated from the agenda. First, I'd like to congratulate Commissioner Klein, on your appointment. Thank you. Pretty soon, we probably should have the meetings in Parkland, since none of us are from there. But in our bylaws, under section 7.6, duties of the chief of staff, to represent the medical staff to the chief executive officer and the board of commissioners in matters of concern to the medical staff. We are not on the agenda for this meeting. You know when I was told this morning, I don't think that's very fair to me or my fellow chiefs of staff, to be honest with you. I think I know where it came from. You know, I am not sure, you know, why we have to be here. Why we have to, we all have to cancel our office this afternoon, lost a lot of money because of this. Chiefs of staffs are not on the agenda.
No, hold on a second.
Well, no, can I finish?
No, hold on a second. Hold on a second. You can finish that, but we're not gonna take any more. Folks, I got some people that have to leave here. You can go ahead and talk.
Well, I think in my years of service, I'm entitled to address this.
You do.
Okay.
But, you know, let me tell you that we have a process which is called public comment. And you know, I would have much appreciated that being done during public comment, because this is an item that is out of the agenda. I gave you the courtesy, Dr. Yogo.
Okay.
Go ahead, finish.
I appreciate that, but I would have appreciated knowing more than 3 hours before the meeting.
But I'm not taking anybody else.
Okay, that's fine. I think I speak for my fellow chiefs.
Oh, good.
We've been eliminated from the board report for our credentialing, which is, by JACO standards, a medical staff function. The creation of the call schedule, the responsibility of that at this moment seems to be in the process of being taken away from the medical staff. That may be a JACO violation, okay? And it's also a violation of other bylaws, of our bylaws, specifically section 8.6.6123. You've created, they're in the process of creating a call policy which pretty much eliminates private physicians unless there's a severe need. Now, approximately 2 years ago, maybe, the board came up with a policy that the call schedule would be open. And in my opinion, it's pretty much a restriction of trade. It's not a violation of the CIA. You've alienated all the private physicians by doing a lot of this. And these, I've said many times before this board, are your real customers. But nobody seems to care about that. There's no primary care physicians that work at Broward Health right now. So I just needed to get that off my chest. I think it's unfair. The chiefs of staff are an important part of this organization. Medical staff is an even more important part of this organization. I think there's been an effort to devalue physicians, not only here, I think across the entire country, but specifically here. I said my piece, do with it what you like. Any questions, I'm happy to entertain it. I'll give you all my cell phone number if you'd like to talk to me more about it. And I think it's unfair, because these decisions are being made unilaterally. None of us knew any of this before 2 hours before we walked into this meeting, period. We were told, it's not true. One other thing, I'd like to give kudos to all of our physicians that stayed 24 hours in-house at Broward General and other hospitals to serve the potential victims of the hurricane, okay? Just goes to show you, in the time of real need and desperation, a person's true character really comes out. Thank you for this time, Mr. Chairman, I appreciate it.
All right, thanks. Tabasco.
Thank you. So, first of all, I would like to begin by thanking our outstanding Broward Health employees for their dedication, cooperation, patience, and commitment to us during and after the hurricane. Alan Goldsmith and I were hunkered down in the bunker in the IS building for 3 days in the command center. I will tell you that the physicians, the nurses, the healthcare workers, the environmental, food and nutrition, they were an amazing team. We're right next door to Broward General, but the CEOs will tell you we had conference calls it's scheduled twice a day. Sometimes as issues developed, we had more conference calls. A remarkable display of teamwork throughout our hospital system. It was amazing. You know, our community has come to trust Broward Health for not only their health care, but now they can rely on us during a storm. So I'm very proud to be a part of it, and a special kudos out to our CEOs. Jasmine, who stepped up, thank you very much. She was there. She knew the whole community, ins and outs of our outpatients. So I want to thank you all for that, because it was an unbelievable job. Now I know that we met Peter, but I was just going to ask our three new talented leaders. Well, you met Peter. We have Gino Santorio, who's our Executive Chief Operating Officer. Thank you. And then Beth Cherry, I think I saw, our VP of Physician Services. So as we build our new team and strengthen Broward Health, I'm also working diligently to ensure that we're using our employees' times and talents where they're most needed. As such, I believe next board meeting, I'd like to start reporting, give you monthly reports, and not limited to just because I'm saying monthly and quarterly. I'd like us to do safety and quality, a building report, contracts, finance, credentialing, compliance, and ethics on a monthly basis. So this way we'll keep, and if we need to, as a quarterly, we're going to talk about strategic updates, audit, and community relations. But as things arise, it's not limited just quarterly. And then on an annual basis, I'd like to report on governance and personnel and HR, but as you see, as the need arise. One of the other things I'd also like to bring up is the accomplishments of our team here and my team. I want you to know, for the board, that we're making great progress on improving our patient outcomes and reducing the reliance on our taxpayer funding. We've also implemented a budget for 2018 based upon our rollback rate for our property taxes, thus again saving money for Broward County taxpayers. As I told you, I hired key personnel, and I'm also evaluating and determining all interim positions. The team and I have renegotiated contracts, which is resulting in overall savings, and I'll bring you the dollar amount, as Alan is keeping track of that, so you'll know that. Also, with the hiring of Beth, we are restructuring the employed physician model of medicine, and we'll update you on that. I'm also restructuring and centralizing several departments for greater efficiency, and reviewing and revising policies. The work in progress is changing a silo workplace and culture. I'll be working on leadership development, team bonding, etc. I'm also evaluating all the properties we have. And just the business at hand, I want to evaluate all the programs and services at Broward Health. We've got some great centers of excellence. We need more centers of excellence. So those are some of the things I wanted you to be aware of that's been happening over the past several months. I couldn't do it without my team, and I just look forward to continuing on this path, and again, to improve our patient quality outcomes and also lessening our dependence on taxpayers. Thank you.
Thank you. General Counsel report?
Thank you. I have one item, which is to reintroduce to some of you a new addition to the General Counsel's office, which is Jerry Delamo. Jerry was here and then kind of lost his mind a little bit, left, and couldn't wait to get back. So he's back now. He's a senior counsel in the General Counsel's office, and so we are pretty well stocked up for right now.
Hey, thanks. So Irma brought him back, right?
I'm sorry?
Irma brought him back.
Yeah, he was here before Irma, but a good wind brought him back.
Okay, we have Mr. Goldsmith. Alan, acceptance of your financial report.
Is it working? Hello everybody, how we doing? Good? So listen, this is going to be very short because I have good news for you guys. We had on a net loss from operations, we lost 8.3 on a budget of 11.6, which is favorable by 3.3. I do want to highlight though, we did have a one-time cost report settlement that nets out to about 3.3. So if you back that in, we basically hit budget. So I was very happy with the results, especially in the summer months. Some things I want to really highlight and talk to you guys about what I'm working on with the CFOs and the teams. We think that overtime as a percent of productive labor is very important, so we're really pressing them to be at 2.5%. In each interim financial statement that I present on a go-forward basis, I'm going to go over the numbers and I'm going to go over where each facility is at. We have very aggressive plans that HR is working with the teams to make sure that we hire people so that we have the best quality of care possible. So I'm very excited for the results. So maybe we can get a lot more people from Parkland to work for us. I'll be happy about that. If you look at our hours per adjusted patient day, the one thing that is we ran a little unproductive at 28.6 on a budget of 28.2. We're a little unfavorable by 1.4%. We have plans in the future to bring on a productivity system that's really going to help managers on a daily basis manage our productivity and our labor. If you look, our SWB as a percent of our net patient revenue is 60.3% of the money that we bring in or potentially should be bringing in. So labor and cost of labor is the most important thing that we need to stress on a go-forward basis to really drive results. We have a lot of tailwinds that are coming our way with the Medicaid rates and other things that are coming our way, and we really need to be the most efficient possible healthcare system to provide the most quality care that we can possibly bring. So that's sort of our month, if you really say, to a T. If you look at it on a year-to-date basis, we're favorable by 3.4 to budget, and we're favorable 2.5 from prior year. So we're a little ahead of prior year. If you take into account that one-time cost report settlement, we're a little bit behind. There was a few facilities that had a rough couple months, and I've talked to the CEOs, and we're talking on basically a daily and probably weekly basis about how they're going to drive results to the bottom line. So I look forward to their plans, and I look forward to seeing how they make up their budget deficit by the end of the year. I'll go real quick. If you go look at our cash on hand, we had 184 days cash on hand. Our accounts receivable days I'm a little disappointed in, and I've worked with Janice Mitchell, who's our vice president or our revenue cycle person, is at 51 days. We really need to be at 45 days. And that's something that, as I get more into my role, I'm going to really drive to bring cash in the door. If you look at our debt to capitalization, we're in line at 19.4. Our debt to service coverage is 3.6. Our capital spending ratio is 163%. We'd love to spend money here. And then our excess margin was 5.1%. So from a key financial indicator perspective, I think that we're in line. And once our leadership team gets in line, I think that we're going to really be able to drive up our credit rating and S&P that was taken down based off of our financial indicators. Does anyone have any questions on the financials that I can give to you guys?
Anybody has any questions?
And that will conclude my report.
Thank you.
Okay, so is there a motion to accept the financial report?
So moved.
Moved by Commissioner Whalen,
Second.
second by Commissioner Uri. Any discussion? All in favor?
Aye.
All right. Jasmine, you're on.
Good evening, Commissioners. Thank you very much.
Good
Behind tab 8 is an exhibit that comes from Primary Health Care Services. It's an authorization to execute a contract between Broward County Government and Broward Health for the continuation of our Primary Health Care Services Agreement for the period October 1, 2017 through September 30th, 2018. By way of some background, I believe at least two of the commissioners, this will be your first time going through the Broward County primary care contract. So by way of some background for you, on page 2, we've been providing under this contractual agreement for the past 24 years with Broward County. And that's to provide the primary care services throughout the northern 2/3 of Broward. South Broward Hospital District has a similar agreement where they provide services for the southern 1/3. We have approximately 8 community health centers that are actually a part of this particular arrangement. The 2 that are not are our healthcare for our special treatment of HIV/AIDS patients. Those are specialty type clinical operations that have other federal grant funding in, but all of the other centers do provide general primary care services. So for these particular service provisions, this particular contract, over the 24 years, we have surpassed some of our outcome measures, performance and quality outcome measures. So the county back in 2016 and 17 did indeed change those performance measures and upgraded them in line with HEDIS measures, or HEDIS measures that you are very much familiar with. So that's outlined for you on page 3, table 1. We continue to meet and or exceed these benchmarks, which is an indication of the quality of the services that we are providing. We've continued to, not only from the inception of the contract, provide additional access points of care. Originally, when this contract came into being in '93, there were 2 sites operated by Broward Health in the northern 2/3 and 1 site down in the southern half of the county by Memorial Healthcare System. Broward Health currently operates 10 centers, of which 8 of them are strictly the general primary care. So we have increased those access points. We have increased the quality, and henceforth the changes in the performance measures that they hold us against. We've also expanded population health initiatives, disease state management, and care coordination opportunities. And as a result of that, and working with our physicians, nurses, the care team, and the patient, reducing avoiding costs to the system for additional unnecessary ED visits and or readmissions to the hospital. So we're very proud of the work that the staff have continued to do over the past 24 years. This particular contract is for $8,495,420. It is budgeted in 2018. It's level funded from last fiscal year, and it will be projected in, as well in fiscal year 2019. If you don't have any other questions with regard to the background of this particular arrangement, I will conclude with the recommendations from staff that therefore it is requested that the Board of Commissioners of the North Broward Hospital District authorize the interim president and CEO to execute a contract between Broward County and North Broward Hospital District for the continuation of primary care services for the period October 1, 2017 through September 30th, 2018 in the amount of $8,495,420. This contract is level funded and has an optional renewal of 1 additional 1-year term if executed. The contract is subject to approval by the General Counsel's review and approval as to legal form and conditioned on no material changes in the approved business terms.
I support this program very much. For years it's been doing a lot of good work, and it's a good thing. So I hear a motion to support.
So moved.
All move and second.
Okay.
All in favor?
Aye.
Okay.
Thank you very much.
All right. Do we have anything else in here? No. Comments by commissioner. Oh, Dr. Westphal, where are you? I lost you. You're lost in space.
Yeah.
Yeah. Okay, the Dr. Rodriguez Cortez?
Yes, correct.
Okay.
Yes. North Broward Hospital District is requesting to renew an employment agreement with Dr. Hector Rodriguez Cortez. Dr. Hector Rodriguez Cortez received his medical degree from the University of Puerto Rico School of Medicine in 1991 and completed his pediatrics residency also at the University of Puerto Rico School of Medicine in 1994. In 1997, he completed a postdoctoral clinical and research fellowship at the University of Texas Southwestern Medical Center and Children's Medical Center in Dallas, Texas. Dr. Hector Rodriguez Cortez joined Broward Health in 2005 and has been instrumental in the development of Broward Health's Medical Center's Pediatric Hematology Oncology program. The program has implemented life-saving cancer treatment protocols for our pediatric oncology population. He is a board-certified pediatrician with a subspecialty in pediatric hematology oncology. A community needs assessment has shown an insufficient number of pediatric hematology oncologists to meet the current and future needs of Broward Health service area. Broward Health is requesting that the Board of Commissioners approve the execution of the agreement with Dr. Rodriguez Cortez for a 2-year term. A fair market value assessment for the proposed payment to Dr. Rodriguez Cortez was conducted by an independent third party with FMV, and it turned out it's at the 83rd, not the 84th percentile, and deemed to be within the FMV for similar services being provided across the country. He will be at the Salve Children's Foundation at BHMC. Administrative services will include being medical director for the Pediatric Hematology Oncology Department at Salve Foundation Children's Hospital at BHMC with Children's Medical Services and for the Florida Newborn Screening Program. He will also be responsible for serving as the principal investigator for the Pediatric Cancer Children's Oncology Group. Commencement date is October 1st, 2017. It's budgeted. The justification is to continue to provide clinical and medical director pediatric hematology services at Salop Foundation Children's Hospital.
So do I hear a motion to accept Dr. Westfall's presentation? Moved by Commissioner Yuri,
Second.
second by Commissioner Westphal. Any discussion?
I'd just like to point out in response to Dr. Yogel's comment, we do, at least the board has always valued the chief of staff in any of these discussions. And I noted, I mean, obviously wouldn't have approved, even though I really like Dr. Westfall's abbreviated summary, because we really do have an awful lot to do, that every chief of staff has signed off on all of these recommendations that I've seen, and especially one where there is a renewal of an agreement that requires our approval. Then we do need to make sure that the chiefs of staff have been involved. I think from my standpoint, it's really more of an allocation of resources, and the fact that this is the job of the chief of staff. One of the many jobs of the chief of staff is approve this and certify to it. And I guess I believe that you would never be recommending that we approve something that the chief of staff himself of the facility where that physician is going to primarily be involved hasn't already signed off on. And I went back through to make sure that with respect to every facility, that even the small changes had been signed off on by the chief of staff of that group.
Yeah, and to your point, one of the things that we discussed at the chief's meeting a little bit earlier was that if there were any changes that related to the credentials committee report, that if we saw a variation, that I would call them before we ever made that presentation, so we had that dialogue.
Right, and I think, I mean, all of this goes back to, in my view, the gut-wrenching change that we're sort of under by all of the regulations, that we're not just one facility, another facility in silos, we're all in this together. And the reports need to be consistent, and you know, we do read them in advance, but you know, the one thing I want to make sure of is that the person who has the most contact with that physician, who's actually looked at the documents, and I looked at some of the settlements with the physicians. I mean, we all know there are lots of settlements, but that someone's passed on the fact that this person meets the requirements for the institution to serve here. And I for one, because this is new to all of us, I appreciate the summary, and I applaud your efforts, and I hope that if it's a communication error somewhere along the way, that we can get that corrected, because the chiefs of staffs are incredibly important, and certainly we're happy to hear from them at any time. And I think that maybe we start more of a dialogue, if that somehow has been with the CEOs and with the chiefs of staff, that we're going to be one institution by requirement. And we're going to do it, it's going to be slow and painful, but I think this is an initial step. And I thank you for that. And I thank management for trying to get this in a more manageable approach. But certainly if for some reason along the way something changes, and we used to have a lot of amendments that we added, and unless I'm mistaken, I didn't hear one amendment to the materials that were before us, so that we could approve it as presented in the book without having to amend it by, no, that person changed their mind. So I applaud you on that.
So,
I think you need any other comments on that?
well, did we pass this motion?
No, it's just discussion. I don't know if anybody else has a comment. It was just an
Anybody else?
observation.
I'll hold my comment to the commissioner's comments.
Okay, very well. So, all in favor?
Aye.
Aye.
Thank you.
Thank you, Dr. Westphal. All right, next, let's start with, since you hold it till now, Commissioner Wellens, as it gets to the floor.
Yes, that was out of order.
Well, welcome everybody. I know this has been a trying few weeks for everybody. I personally was not in town, but I was in contact with senior management, and all I heard was the teams at the individual hospitals were doing a phenomenal job. The doctors, the nurses, the staffs, the back office, the food service, you all are what makes this organization live. And we're going to succeed as a group. We're not going to succeed as individuals. The 5 of us on this board here have very little to do with the day-to-day. We have virtually no input on what happens in your hospitals on a day-to-day basis. That's up to you and your teams. And from what we see, we're making huge strides. It may not be apparent to everybody, but it's there. And I personally stand with this senior management team. They have done a phenomenal job. 2 months ago, think about all the senior management positions that were not filled. We now have a Chief Operating Officer just joined us, Gino, welcome. Alan joined as a CFO. I spent an hour with him in my initial meeting going through the financials. A terrific presentation, a real understanding of the numbers, and someone who will keep us moving in the right directions financially. Peter, I think, is going to be great in HR. He's got great experience. We're welcome. We're happy you're on board. Beth, I have not met yet, but I'm happy to see you here. This team has been in place for a very short period of time, and I think they will be here to support the staff, the doctors, the management teams, the nurses, everybody that makes these hospitals run. And I think you just have to give us an opportunity to exceed your expectations. Change is never easy. It's not easy in my organization. It's not easy in any organization I've ever been involved where I've delivered change. It sometimes is difficult, but I think look at the big picture. We're moving in a direction of making this place a world-class facility. I personally have too many other things in my life that I could be doing. I sit up here and I fly back and forth from wherever I am to be here to support every one of your efforts. And I will tell you that we will succeed as a group. We're going to have disagreements. Let's talk about them. Let's work through them. Let's look for solutions. And let's have an understanding that sometimes things look different when they're changed, but in the end, we're going to look back 6 months from now, and I think everybody is going to say we are better for the change, we're better for the effort. And I think the team that's in place in the senior management is going to give you a lot of support that we have not had. So I wish you all the best. I tell you, stick with us, hang in there. Things are getting better, and we are going to be a world-class facility. And I personally want to thank Bev for giving up 6 or 7 months of her life to do this, and she's done a phenomenal job, and I think she's assembling a team and working with you, and let's just give us a chance. We're getting there. So we hear you, and we're willing to try to do what we can do. So that's all I have to say, other than thank you for your efforts.
Commissioner Uri?
Well, my family and I were one of the fortunate millions that evacuated Florida, but I want to thank everybody in this organization that stayed here to help this community. As I've said a number of times, that this system is a tremendous asset to this community. It supports this community, and as I said before, these times are really important for this community to support this system. When I came home, of course I was relieved that the path of that storm didn't follow the original path, but I still could not believe the amount of destruction, both at my personal home, but also this community. And the analogy that I want to draw for everybody who's listening is that the winds of change in this healthcare industry are blowing just as strongly. And I will tell you that there is no system, including this one, that is going to avoid the eye of that storm. We have had, in my opinion, and I've said this before, a pretty significant leadership vacuum in this system for entirely too long. And I believe that's why some of the pains of change are that much more acute, because we don't have the good fortune of being able to ease into things or wean off of practices and procedures. We don't have that luxury. I too want to thank Bev and the entire leadership staff, but most importantly, every member of the Broward Health staff, because without each of you, none of this community benefits. And so, again, thank you. Stick with us. We are not your adversary, neither is senior leadership. And the sooner we come to realize that we're partners, not adversaries, I can say with a great deal of confidence, the sooner this organization will achieve the potential that I don't doubt it has. So, thank you.
Commissioner, thank you, Commissioner. Commissioner Rose.
It's very little that I can add to what Commissioner Wellens and Commissioner Yuri have said, other than the fact that I think all of us are here with you. While we can't get involved just by law in the day-to-day operations, doesn't mean we can't listen and care and see if we can't find a way for management and every member of the organization to talk to get everything worked out. We have still some troubling issues to resolve. I mean, yes, we got one settlement today, that's great. We still have others to get behind us and to make sure that we can just move on fresh and clean with everything that has been a problem in the past being resolved. Not to say that it's going to be perfect going forward, but I, for the first time, really, truly am beginning to feel optimistic that we're on the right track and that we're going to get things done. And I won't talk about the storm and how horrific that's been since that's already been covered. But one of the things that I'd just like to point out is that, you know, if you'll go back and look at the economics of the organization and things that we felt needed to be done, we never really could get to them. And I think I'm very encouraged, and I guess I could ask Alan at this last minute, probably not the appropriate time, but to talk a little bit about our bond offering. I mean, that's going to be a phenomenal advantage to the organization, and that goes on behind the scenes. You know, I met with Alan and council and advisors to look at getting some documents done, 3 weeks ago, I guess, and you know, these things are being done, and we had a good announcement today on the settlement for significantly less than our friends in Tallahassee would like us to pay. And we're going to get there inch by inch, but it's going to have to be with cooperation. And I think we'd like to get some of these good things out there besides the fact of the performance, the doctors, the nurses, everyone who works in the hospital. Yes, they're absolutely great, but you've got to have the core organization to give you flexibility for drawing on those good things and continuing them. I think the expanding the centers of excellence is an incredible idea. I think it should have been done, but there never was. We were always responding to one crisis after another crisis. And I think we will always have that, but if we've got a steady hand to get some of these things done, and you've got access to talk about them among your organization. People need to talk about the problems in order to get them resolved, but there are usually 2 or 3 or 4 or 5 sides to an argument here and a discussion. And I think we need to have that take place. And I, for one, just wanted to say how much I am encouraged by things that I see in the organization these days.
Commissioner Klein?
Thank you, Mr. Chairman. I certainly echo the sentiments already expressed by my fellow commissioners. I think I'm in full agreement, so I won't replicate everything that's already been said. But as the new guy up here on the board, I can certainly say that I appreciate the challenge as well as the opportunity that's before us, and I appreciate the appointment, obviously, by the governor to help address the challenges before Broward Health, and I look forward to working with the medical staff and with my fellow commissioners and with the executive team to address these things. Bev and Alan and Peter and Gino and Lynn, I think we've got an excellent team in place. look forward to working with each of you to address the challenges that are in front of us, and have confidence we will address those and move forward, and to improve the care, to continue to improve the care that's being provided to our constituents and operate in the most efficient manner possible. Obviously, want to thank everyone who contributed to all of the efforts, the Herculean efforts, not only in this room but beyond during Hurricane Irma and the recovery. And I guess in closing, I just want to say I'm looking forward to hearing the input from everyone from all different sources to continue to learn and to educate myself as to what the issues are and how we could best address those and improve communication as well. So thank you. Thank you, Mr. Chairman.
I tell you, having heard every one of my colleagues, they pretty much sum up a lot of the stuff that I wanted to say. One thing that touched my heart recently after the hurricane, Dr. Yogo sent me a picture of the team and says how proud he was of the team, and I responded to him, that's what we're all about, the team. So I want to thank everyone that took place on everything, whatever you did. I want to thank Beth for doing an outstanding job and taking, like Commissioner Whelan says, 6-7 months out of her life. And but I want to share something with you that my father always told me, and it's what keeps me going. Because I told somebody once, he said, "You guys don't get paid." I said, "No." I said, "But somebody's got to do it." My father used to tell me, tough times never last long, but tough people do. And we're all tough people. So thank you. And we'll get around to be #1 in the country. Thank you very much. Meeting is adjourned.